Howdy everyone, Matt here. I got a question for you. As a PT or PTA, do you think manual therapy is this wonderful, amazing, crazy, cool thing, or is it just a bunch of nothing? Let's talk about that. But first and foremost, let me introduce myself. My name is Matt. I'm Matt the PT, and I'm coming at you with another video on another topic of something in the physical therapy world. Second of all, thank you so much for taking time out of your day to tune into the video. Thank you for the likes, the comments, and subscribing. And if you do feel so inclined, hit that subscribe button. It helps out the channel, and it doesn't cost you a copay. So manual therapy, what are your thoughts on it? There's so much out there. I think more and more as social media spreads and there's more people on it, there's all different sorts of opinions. I love manual therapy. Manual therapy is the greatest thing. Manual therapy is garbage on it, or just all that in between. And I want to talk a little bit about my background in it, the history in it, and kind of what I believe in it. And of course, I want to hear from you as well. What are your thoughts, opinions, and beliefs in manual therapy as well? Let me know in the comments down below. Now I'll talk about my background in it. I know in school, way back when in PT school, I remember my ortho professor spoke very highly of manual therapy, that manual therapy was his amazing skill that you develop and you refine through your career, in that it does so many great things for patients. When you put your hands on them, amazing things happen. And that's what separates you as a provider from other providers, that you have these skills that do these wonderful things. I know that's in the classroom. That is different than in the real world. But stepping into my last rotation was with a CI who was very established in the community. He had this clinic for 20 plus years when I was there, and was very hands-on with his patients, and who had, he had said, because I've learned all this stuff, like the special tests and techniques over the years as it had been developed. He was very willing to invest in that knowledge, things like that. And he had the belief that everyone that came in the door, you need to put your hands on them in some form or fashion. And I did, with him, see so many positive things with manual therapy, of what he did with patients and how well patients responded. And I will say, I was very heavily influenced by him going into my first career, my first job. I know many students are typically influenced, again, but I always say that, by their professors or their CIs. You kind of have that influence. So when I got to my first position, everybody, it was a outpatient facility. So a lot of aches and pains, post-operative patients. And I felt, need to bring this in here. Put your hands on everybody in some form or fashion and provide those skills, those techniques to help them. Because so much in manual therapy that you read about has positive effects, that you can do it for pain relief on it, for like facilitation of movement, or, to help improve range of motion. So as you see, really, those are kind of the biggest things that patients are typically come from. They're hurting, have a loss of motion or a loss of function through weakness or something. So maybe you put your hands on them some way that it facilitates all those positive things. And so you can see, oh my gosh, it has all these crazy cool things to it. And I know I applied it to everybody that came in the door. Well, I'll tell you this. I did start finding patients during that time that didn't respond as well to manual therapy. And I do remember one patient that had a knee pain, and I was applying very gentle mobilizations to them, and they were saying that it hurt them so much. And I was confused, because it was saying we were taught the high oscillation, very low amplitude. So like the grade 1s, if you're using the Maitland scale, should be facilitating, those, or stimulating those receptors to help decrease pain. But this person is telling me that they are getting worse. I'm well, why is that? And then just kind of stuck around the back of my mind. Now, also go over, and through this time, I started getting into the McKenzie training. And if you know me, I am a diplomat in MDT. So I went through all of the McKenzie stuff. And it really talked about not being so hands-on with it. And so early on in, part A and B, you're not putting your hands on people. And so I kind of changed it up, saying I don't want to put my hands on patients as much. I don't want to do that. I want to facilitate more of patients moving by themselves. And I don't need to be so hands-on. I wasn't anti-manual therapy at the time. I just really tuned it down a whole lot. But I'll tell you this, and this kind of gets to where I am now. And I have went, like I said, through I'm a diplomat in MDT, so I've got the highest through there. I'm a fellow of the AAOMBT. So I've done a lot of manual therapy courses over the years. And I have a ton of books and stuff on old manual therapy techniques. That's one thing I absolutely love to do, and I'll do this at old bookstores. I go look for old medical books, especially orthopedic type stuff. So I do have a nice little collection of them. Probably need to start sharing some of those because there's some interesting techniques and approaches and things in there. But the more I've went through this, I've reached this point in my career with my belief of manual therapy. Now, of course, I want you to share yours, but I like to share mine here. It's been a bit controversial, and I've had some people get upset with it. Typically students, whenever I've ever said this to students, that they've kind of gotten very puzzled and curious about it. But I will say, I said, the more I've went through and learning manual therapy techniques and approaches and skills, the less I actually use them. And the reason why, and sometimes people ask me why, sometimes they get a little angry and they walk off. But it's now that I'm much more selective in what I do because I want to be more selective because I get a better response with what I do. And I'll explain that a little bit right now. So looking back again with these techniques, the more selective, a couple things. I want to understand if that patient is sitting in front of me, are they going to be someone who wants my hands on them? Again, going back to that patient many, many years ago, I see now that patient was somebody that wasn't going to respond to me putting my hands on them. They were not somebody who's going to benefit, even though they had an orthopedic type issue, which I would think would respond to manual therapy approaches. This person didn't. It wasn't on it. But it's coming in to understand, does this person want me to touch them? Will they respond positively if I put my hands on them in some form or fashion? Also understanding, is this person possibly going to get dependent upon me? And that's kind of a knock that people would put on to chiropractors. Now, I'm not talking bad about all chiropractors, but that's the thing that would come up, that somebody would say, like, you get a dependence upon it. And, you come in, crack, come back, crack. And you probably met those people. Oh my gosh, they can't function until they get their back popped or their neck popped. And so if I see this patient, are they going to get dependent upon me putting my hands on them, things like that? Next, so if I understand that this person is or isn't going to respond, going to go through that. And now we're going to go over to say, like, well, what are we going to do with this person? And to understand that I want to do the least amount to them to get the most effect. And again, I look back at my, way back when, and I think this goes along with some of the research as well, that there's some stuff that says like general approaches are much better than, or no different, than specific approaches, stuff like that. And, we've went through, the arthrokinematics of a joint. Let's say like, if you have issues with, raising the arm, you need to follow the roll glide mechanism of the glenohumeral joint. But I know I've recognized over the years that doing stuff that doesn't even mimic what actually happens in the glenohumeral joint can get a really good positive response on it. So, heck, okay, does it really matter at times? So understanding, okay, do I need to use a really possibly specific thing with this patient, or could I be more general? Typically, with patients, I do that final response. I may be a tad bit more general with them in the beginning. Hey, we may get your thoracic spine moving to help you move your shoulder, maybe move your neck better. We may just do some, general stuff with your back or your knee or something to gain some motion or to get you maybe feeling better. But we're going to do this thing called, what I like to call is patient response. So what happens when we do it? If I do this, what is your response? If we get a good response with it, okay, we're going to keep going. If we don't, we're not going to keep going with that. Also, setting up, of course, with the patient to let them know, I don't want you to get dependent upon me, that I want you to be independent, that of course, that everything that I am utilizing with you is to allow you to do it yourself on it. So again, somebody with neck pain, I have this patient in the clinic right now trying to do retractions to get their neck moving, but it's pretty painful and stiff. Like, they did several sets and they're saying, it doesn't feel good. It just doesn't feel really good. Okay, lay down. Mobilize them and they sit back up and they're going, oh, well, that feels better now. Okay, that's allowing you to do this more effectively at home. Again, I got shoulder patients, the same thing. Utilized quite a bit of manual therapy in the beginning to get them moving. Now they're moving really well. I pull the manual therapy away and educate them. I want you to keep doing this and moving. See that you're getting better, that you're doing this. I applied the least amount to you to get the most benefit from it. And you're not dependent upon me. I'm not putting my hands on you all the time for, 10, 15, 20, 30 minutes. I don't know therapists that do stuff like that all the time with patients. I would just spend so much time hands-on. It's like, could you get more effect with just a little bit with other things? So that's my thought on it, with it. And I'm still learning. I will say one thing. I really do feel that manual therapy is something that is a skill that is learned and refined over time. And I know there's stuff out there where people say like, no, you can just learn these just general techniques and just doing whatever to somebody can get a benefit. I can see why someone says that, but at the same time, I understand if you study something, you dissect it, you get deep into it, and you understand it, are you going to therefore now know how to apply it better? Are you going to know what you are feeling? And that's a component to it as well. We probably could talk about palpation and stuff like that later. But understanding like, oh, okay, I can refine how my hands feel on somebody and the comfort level with that. Could it be beneficial with patients that they see, hey, we have to think of the patient point of view. I'm searching you out because you have this high level of education and skill and that you've refined it. And that's what I want. I want to know I'm coming to somebody who has learned these things, that does understand it. And again, it could be a marketing tool to say like, oh, yeah, so I have these high level manual therapy skills. Well, you may or may not use them all the time, but you really know how to do it on there. So with that being said, let me know your thoughts. Let me know your thoughts, your beliefs, your opinions about manual therapy. Do you think it's all great on it? Do you think some parts on it are kind of goofy? Things like that. And when I'm talking manual therapy, I'm talking about anything with manual therapy. I spoke a lot about joint mobilization. So a lot of stuff that I was just talking about, joint mobilizations, manipulations on there, but soft tissue goes in there. Do I think soft tissue is bad? No, there's some patients that may respond to some soft tissue. What about stuff like passive ranging of motion, stretching with patients? Is that manual therapy? Is that beneficial to patients? What about other stuff? Cupping, needling, scraping. Is that manual therapy? Is that a part of it as well? Let me know your thoughts. Let me know your thoughts, your beliefs, your opinions. Let them down below. Let's have a conversation and a discussion on that. And with that being said, until next time, take care of yourself, take care of your patients. I'll see you then.